Ladies and gentlemen, distinguished guests and friends, our conference is coming to the end. This is the last plenary, and we as two actors, or better chairs, will be trying to accompany you with the last entertainment. And not only entertainment, but especially interesting exchange of experiences on how we can influence, even though the national or international very punitive drug policies exist, how can we make the change from the local city perspective? And as we know, the local interventions make the difference. So welcome. My name is Pavel, and I'm a member of the Global Commission, and this is my friend and colleague.
Hello, all of you. How are you today? I bet you are okay. From a game of fortune, it happens all the time to me that I'm the last moderator or the last speaker of a conference, so we have to be strong, awake, united, things like that. I'm Atzemis. I'm the Harm Reduction Officer of Positive Voice, Greek Association of People Living with HIV, also a board member of the Drug Policy Network of Southeast Europe, steering committee member of AIDS Action Europe, a civil society forum on drugs representative of the European AIDS Trimplate Group, but above all, I'm a peer harm reduction worker and a proud member of the drug user community.
Wow. And now we have a lot of speakers and a lot of presenters, so I will be as short as possible, trying to go very briefly through a presentation of the Global Commission on local drug policy. So please, if I can have the pictures. Before that, I would like to make a statement that it's time to end prohibition and to empower our cities and communities to introduce easily accessible health and social services based on the respect to human rights, starting with harm reduction and ending with full social inclusion accompanied by zero stigmatization. That's a dream. Housing and vocational programs. Cities and local authorities, as we know, have been for a long time confronted with unbearable, unintended negative consequences of the war on drugs. Punitive international as well as national drug policy regimes. Many of them have become, and I'm now talking about the local authorities and local city policy decision makers, many of them have become early birds and missionaries in advocating for effective protection of public health as well as public safety, introducing pioneering innovation harm reduction programs. Cities have been at the forefront of many important HR initiatives since early 90s with the emergence of HIV pandemic. To end prohibition and to empower our cities and communities is not just a dream, according to my opinion. Over the past decade, a drug policy reform has advanced around the globe with a promising progress at international as well as national levels. By 2050, it's projected that almost 70% of world's population will live in urban settlements, making cities a key actor in drug policy design and implementation. So today's plenary gives us a great opportunity to share experiences between cities, city authorities, to mitigate harms of drugs and unintended consequences of drug control regimes. I am representing, next slide please, a Global Commission on Drug Policy, which is a self-constituted body of former head of states, president, and prime ministers. Can I have a, oh, sorry. Yep. Yes. 26 presidents or former head of states, I don't have a time just to go through the Global Commission big names. However, their establishment of the Commission in 2011 as a response to the need to address these unintended negative consequences of international as well as national drug control regimes. Providing data, evidence-based approach, and at the same time advocating for human rights and public health, and to share the experiences and examples of a good practice. We published since 2011 10 annual reports on all possible aspects of drug control policies with 5 priorities: public health and safety first, access to essential controlled medicine, knowing that for almost 80% of world population, the painkillers and essential medicines not available, and of decriminalization and incarceration of people who use drugs, refocus enforcement to target drug trafficking and especially organized crime, and regulate drug markets in order to put governments into control. So we started with public health in 2011, undergoing the highlights, looking at control or decriminalization first, and at the end we moved towards drug market regulations. When we take seriously what I have said about the projection of distribution of the world population in 2050, Global Commission has published a position paper on drugs and cities, on drug policies and city responsibility. And in short sense, the arguments are that there is an urgent need to find innovative solutions and implement what works, and that there is an urgent need to address financial sustainability of harm reduction programs, especially in the COVID-19 time. Major messages. When we look at the position paper, which is available in electronic media, please, if anybody from you would like to have it in a paper, just tell me that, and I will send it you the paper, drug policy and the city government. Objectives of this policy paper was to help cities to deal with the problems resulting from repressive policies, searching for better suited policies to adjust it to the needs of urban population. And certainly we were well aware of the fact that there are many networks and excellent examples of a good practice: Frankfurt Resolution number 1, Vienna Declaration, Prague Declaration, which were trying to get city representatives and city policy makers, decision makers, together to search for better solutions. So there are quite a few recommendations. Taking control of local drug markets by legally regulating access to current illegal substances, to benefit from the modern deterrent strategies, just the opposite of criminalization, ensure that municipal drug policies are coherent and provide a platform to include everyone involved, and certainly health and safety first. This is what is in short sentences the core of the paper. And now I do not want to take more time.
Just
and
a short comment.
Short comment from you.
Short comment. In that regard, the Fast Cities project is a project that we take it very seriously. As HIV advocates and harm reduction workers, we want a tolerant city accessible to everybody without exclusions. So, and prohibition is the first stage of excluding people. So in that regard, thank you very much for your insight.
Thanks a lot. Now we have we have two fantastic examples of a good practice, and we start with Austin Carroll. Gentleman who is unbelievable. I cannot just spend here enough time to share with you what he has achieved. However, I mention just a couple of projects. Safety Net, which provides GP services for over 6,000 marginalized patients. Partnership for Health Equity Research, Education Policy Services. Well, Austin, floor is yours because it's really admirable what have you achieved.
Just the flicker. Oh, thank you. Hello, everybody. Nice to meet you. My name's Austin. I am not an ex-drug user. However, I am a person with a disability and was involved in disability politics. Disabled people too had to struggle for their freedom. Disabled people too had to fight against stigma. And disabled people also believe nothing for us without us. I am going to tell you about the harm reduction during the time of COVID in Dublin. And the story started in Wuhan in China long ago now. And we were worried because we provide services for homeless people and drug users. And if one group of people were going to do badly in the pandemic, it was homeless people. They have all the structural determinants of health in terms of shared settings, shared dormitories, shared eating areas, etc., that the infection would spread. And we also know that they have very poor health, so if they got infection, they would highly likely do badly and end up in hospital and die. They have low life expectancy, poor physical, mental health, etc. Just some statistics. Mortality rates for homeless people internationally are 3.5 to 40 times that of the general population. And in Dublin, 1 in 33 have HIV, 1 in 4 Hep C, 1 in 3 have attempted suicide, etc., etc. So there was a real palpable sense of fear. We all felt the fear at the start of the pandemic. And unfortunately, at that time of fear, many services turned up to help, but some services disappeared during that time of fear because that fear was very high at that time. And there was a fear of increased, also as well as a fear of the loss of health, there was a fear of increased drug usage at that stage. So, Mike Allen, who is an Irishman, we're proud to say, the head of the World Health Organization, said, in a pandemic, you must be fast and have no regrets. You must be the first mover. The virus will always get you if you do not move quickly. And that perfection is the enemy of the good in a pandemic. So we had meetings. We had all these organizations, meetings. There was a chaos of meetings. All good intentions, but chaos. So we put structure onto that chaos. And the structure was that we brought together health, housing, and drug addiction services into meetings. We had meetings between health and housing, meetings between health, housing, and the voluntary housing sector, meeting between health and the harm reduction and drug treatment services, and between housing and drug services as well. Sorry, and I'll move on. So, the scale and complexity of we had a lot of homeless people in Dublin at that stage. This gives you the scale of the actual problem we faced. So we set up a structure which was led by the housing, health and drug services and harm reduction services. I was the HSE clinical lead. And we had a number of involvement of all the range of agencies, voluntary housing agencies. We had harm reduction services such as Ishka and Anna Liffey Drug Project, who are here with us today. And we would find people who were positive, move them into new isolation units. And when they were in isolation, we would also contact trace and move people into isolation. We also identified the most medically vulnerable through a scoring system. If you were 40 to 50 years old, you got 1 point, 50 to 60, 2 points, etc. If you had conditions such as diabetes, you got 4 points. If you had HIV, you got 2 points, etc. And when we scored people, we identified the most vulnerable to COVID, and we put them into their own accommodation in a single room where they could keep away and restrict their movements. Sorry, I jumped to 2 services. So, that's the actual how we actually ran the system of contact tracing and isolation, etc., the infection control. In terms of housing, we created because the rental market collapsed and the Airbnb collapsed, we were able to get cheap accommodation. So we got new isolation units which we staffed with nurses. We got shielding units which were old, beautiful Airbnb apartments that were left empty, and so we could easily rent them cheaply. And we also looked at the homeless sector where there was overcrowding and took people out of overcrowded circumstances. This shows you the numbers of people we both tested and isolated during the first 2 waves of the pandemic. And this shows the numbers we put into shielding. We put a lot of people into shielding, and I'll show you how successful that was towards the end. Harm reduction. The big problem was we had people in isolation and we had people in shielding, but if they used drugs, they were going to leave the isolation and leave the shielding, so we needed to do something to ensure that they stayed there. So, opiate substitution treatment is available in Ireland, but we had a 12-week waiting list. So if we had people wandering around for 12 weeks, COVID would spread. So overnight we were able to reduce, and there was also there was a heroin drought there. So overnight we were able to reduce the waiting time from 12 weeks to 3 days. Now the question is, why was it 12 weeks in the first place? And that's why a crisis... But that is why the opportunity of crisis, it allows you to do these things that should make sense in the first place. The second thing was we had a lot of street benzos. In Dublin, people take up to 60. I saw someone taking 100 tablets a day. So it was a big benzodiazepine problem. So we actually started, people who were on benzodiazepines a long time, we started them on benzo maintenance, and organisations such as Anna Liffey Drug Project, Chrysalis, etc. would deliver their medication to them. We also, as well as benzodiazepine maintenance, we did benzodiazepine detoxification in the community. We do this a lot. We have a national protocol which we run, again with Anna Liffey Drug Project as well, and where we actually as doctors run it's around a 4-month detoxification program which we're currently evaluating. We also, naloxone, the distribution of naloxone was happening in Ireland, but it is legally complex. And overnight, we found circuitous routes around the legalities. And again, that's because the opportunity of crisis allows people to think creatively. And we found ways to distribute naloxone more widely. And again, the harm reduction agencies were distributing naloxone to make sure that overdose was prevented. Obviously I'm thinking naloxone's important. We also ran a vaccine campaign for homeless people, and the big issue in vaccine was there was a huge rate of vaccine hesitancy. People did not want to take the vaccine, they were scared. We did a survey, and these were the reasons we found people were scared of the vaccine, for all these different fears and myths, etc. So we equipped agencies, and when I say this, we equipped housing agencies, we equipped health agencies, and we equipped harm reduction agencies, so everyone was out working for the same cause. And that's really important. We all had a common vision and mission that brought us together. So this was our vaccine clinic, and we also ran a mobile vaccine clinic as well. So the next phase is we're moving into mobile testing. And this has actually been done with the Anna Liffey Drug Project, who's again a harm reduction agency. And this is where we can get a result within 15 minutes. So now we don't have to send so many people for isolation, because we were sending many people for up to a day while they were waiting for their tests. So just the outcomes very quickly. This was January last year, when the rate in the Dublin population was 5.5%, the rate in homelessness was 2.5%. We were less than half the rate of the general population, and in the shielding units the rate was less than 1%. When you compare that to Boston, where there was a rate in the homeless population of 30%, or in Paris a rate up to 50% of COVID, it shows we prevented infection. We also prevented death. We expected up to 23 deaths in the first phase. We've only had 5 deaths since the actual start of COVID since. So I won't go through all the other outcomes, but just to say, in terms of harm reduction, we had many people started on benzodiazepine detox, many people started on benzo maintenance, and many people started on opiate substitution treatment. And our shielding units, the good thing about the shielding units is not only did they protect against COVID, they helped people's physical and mental health. They felt good because they had their own accommodation. They should have had it in the first place. So that's the addiction outcomes. Again, more methadone maintenance, more benzo, and more harm reduction measures. Our vaccine coverage was extremely good, up to 90% in the shielding units and 80% in single homeless. The great thing was we got political commitment. The ministers of health, housing, addiction promised that in future, because we were so successful, that they would in future ensure that we would always address homelessness, housing and addiction together as one section. And they also committedly committed funding as well. We also got a lot of public support from the newspapers as well, and the public were very behind us. The lessons from this. Another important thing, as I think, is we brought 3 different philosophies together in this movement. We brought harm reduction philosophy, and we brought the structural determinants of health philosophy, which health services like us use, and also childhood or trauma-informed care philosophy. 3 very similar philosophies, but philosophies that actually help each other philosophy cover the gaps that the other philosophy has. So I think it's important that we expand our conception beyond just harm reduction. The other philosophies also contribute to how we can help people. So just the fact of supporting a good outcome is that we had everyone working together, collaboration, a common vision and mission, and the fact that there was clear roles and responsibilities and clear governance. I also think to mention that we have in Ireland, in the health service, a group called Health Social Inclusion, who are specifically there to ensure the health provision of care to people who are marginalised, such as homeless people, drug users, migrants, etc. And having that agency was very, very helpful in terms of promoting the services. And I think I'll finish there, and thank you very much for listening.
Austin, congratulations. Can I move to Dublin? Well, it's a phenomenal example of good practice. The another one is Zurich. Actually, whenever I'm sitting on the governmental meeting, just fighting with ministers of interior or prime ministers, searching how to explain them that the best way to get rid of black market with drugs is to distribute and provide the adequate medicine to those using these substances. So heroin-assisted program from Ambros Uchtenhagen is something what I probably mentioned hundreds of times, that this is the way how to just disappear almost the black market with the heroin, accompanied by the violence. So I have the privilege to ask Mara to come, and Luz Brügger is Madam holding a bachelor degree in social work from the University of Applied Science of Bern. She is a deputy team leader of ZIP, Safety, Intervention, Prevention, Zurich, specializes in conflict and social space management as well as to addressing vulnerable people in the city of Zurich. So Mara, floor is yours.
Thank you very much. So as you see on the slide, Zurich stands for Safety, Intervention and Prevention. Zurich, it's actually the name how we call Zurich in Swiss German, so if you're wondering. I'm going to present you our work, what we do. The title is From Open Drug Scene to Social Space Management and Coexistence. Oh. I was a bit too fast. As you maybe know, Zurich is a well-known example of an open drug scene called the Needle Parks in the 80s and 90s. Not only people from Zurich were there, but basically from all over Europe. So you have the comparison with the two pictures of how it looked in the 90s and how it looks nowadays. SIP Zurich was founded after the closing of the drug scene, because if you close a drug scene, if you move it, it doesn't just vanish. It still exists. People still take drugs. They don't just get overcome their drug addiction in one day. So the people just move to different areas. And if you close those down, they move to different areas as well. So SIP Zurich does outreach social work in the whole perimeter of the city of Zurich. We are on foot, by bike and by car in the whole area of the city. But we also have a second branch. It is entrance control at the supervised drug consumption rooms. So if there are drug consumption rooms, there's also a neighborhood, and I think many cities have this issue as well, because the people need to come and go from those consumption rooms as well. So we have one person in front of the consumption rooms that actually checks the entrance, and also the close-by neighborhood, so the street and the near area. The outreach social work, it's not only about drugs, but it's basically about all of the different social problems in the whole area of the city. So if there's a conflict in neighborhood, if there's homeless people, if there are people in need of medical help, tourists who get stranded in Zurich, also youth, partying, basically anything is what we cover for. So we actually walk through the city with a very open and wide eye. We talk to a lot of people. We are also connected to a lot of organizations, and we bring the people there as well. So as you maybe know, Switzerland has the 4-pillar drug policy, which evolved after the closing down of the Needle Park and the open drug scene. First of all, there's prevention, there's therapy, there's harm reduction, and of course there's also repression and law enforcement. So what we found is that all of them are very good, but they need to go hand in hand. You cannot just take one single pillar and think it will solve the problem, but they will need to go together and also work together and have the same visions as we heard before. I have an example of drug consumption in the public area. So basically the policy would be that the public space must be accessible for everybody, which we call coexistence. So there are basically in a park people with families who walk their dogs. There are people who use a park for going to work. There are different groups, also people who take drugs and also people who drink alcohol, for example, or use the park in the evening for partying and so on. And our goal is that they come together or at least get by each other. And what we found works very well is that the fragmentation, so if you have one single person using drug on public ground, you actually go and talk to them, you look at their situation, you look, can they actually go to services, can they go to the consumption rooms, and you start small, so every single person counts, because if you don't look to every single person, a drug scene can evolve quite quickly. So we see what is their situation. We are in good communication with the police as well and with different other organizations, and we send them to those services. Also, consumption rooms, we have 3 in Zurich right now, and they have different time slots of entry, and they're in different areas. So it's not just one big scene, one consumption room, and everybody gathers around it, but they're in different parts of the city and different times of opening. So basically what we do, we are the link, and we also follow, of course, those opening hours. So you know exactly when are a lot of people in which area of the city. That is also a part of the social space management. And what is very important, because there are so many different organizations, so many different forms of how to help people, we need those people as cooperation partners. So those on this slide, there are just a few, but there are many more. In Zurich, we actually have a booklet. We also give it to people with all the organizations. And we are mostly the link to those organizations, because people may not know about them, they don't have an overview about them. It's a big system. And what we think is that complex problems need complex solutions. So all the players in that field that have some part in the problem-solving area, they must work towards the same goal. And they also need to know each other. So basically we also conduct a lot of meetings, as Austin said before. But it's very important, because you need to be face-to-face, and you need to understand each other, know which role has, which organization has which roles, and also on all of the levels of those organizations. So the people who work closely with the clients, but also on every level. And what we did is we also applied this 4-pillar system, not only for drug addiction, but also it can be used for different kinds of work. For example, for youth work, for consumption of alcohol. In the city of Zurich, noise pollution is quite a big topic, so people get quite angry if it's very loud in their neighborhood as well, from partying, for example. So if all these elements are established, then they can be useful in different areas. So thank you very much, and you're very welcome in Zurich as well, so if you have any questions.
Thank you very much, Mara. Next speaker is Levgen Kushnir, the part of the Alliance for Public Health in Ukraine. He is also this is a leading non-governmental professional organization making a significant impact on the epidemics of HIV, tuberculosis, viral hepatitis. And Levgen is also currently managing Fast Track Cities approach in 25 cities of Eastern and Europe and Central Asia. So, Levgen, please just give us overview.
Good morning, everybody. My name is Levgen Kushnir, and I represent Alliance for Public Health Ukraine. It's a pleasure that Alliance is one of co-organizers of this panel on Fast Track Cities during European Harm Reduction Conference. Alliance has been implementing Fast Track Cities approach since 2017. So far, we've been working with more than 30 cities in the region. Our work is, we deal with the municipality to help them to develop municipal programs aiming 95. We advocate for money allocation from municipal budgets for KPs, and we also implement some innovative and successful programs in the cities. Today we will see actually 2 short videos, one from Alliance for Public Health, another one from EHRC, and on Fast Track and on our fantastic and successful programs in the region implemented by Alliance for Public Health and our fantastic partners in the region. Moreover, our distinguished municipal partners from the region will share their progress in the cities in reaching fast-track cities goals. I wish everybody a wonderful panel. Thank you so much, and I will kindly ask to play video from Alliance and then from EHRC. Thank you so much.
Thank you.
Dear participants of the European Harm Reduction Conference, what a pleasure to welcome you to the Fast Track Cities session on behalf of Alliance for Public Health. We've been working in Eastern Europe and Central Asia for over 20 years, and it's been a disaster to see the developing epidemic in the region. With donors leaving, important structural choices had to be made, and we are so pleased that cities are taking the lead in controlling epidemics of HIV, tuberculosis, hepatitis, drug use in the cities in Eastern Europe and Central Asia. Role of cities in epidemics is absolutely clear. To give an example from my home country, 5 cities are home to 70% of people living with HIV in Ukraine. Eastern Europe and Central Asia is going through a broad decentralization reform, which means that there are more and more resources and more decision-making power available to the mayors of these cities, and the choices that they make in health and in responses to HIV and drug use are critically important. It is so rewarding to see that the cities, the mayors of Eastern Europe and Central Asia are now becoming a true healthy cities movement. As for today, already 26 cities have signed Paris declarations. They didn't only declare their willingness to respond to HIV among key populations, but they made concrete steps to make it a relevant, strong and resourced response. What a bright example of Odessa. Great to see Iryna in the session today. In 2017, the city developed a program to respond to HIV and TB and allocated over $2 million over 3 years period, with most of resources channeled to programs of opiate substitution therapy and syringe exchange through pharmacies. Other examples followed. It was the small city of Belz who developed the program and allocated municipal resource. The city of Chisinau, which is also part of the panel, also developed the program and allocated resources to key populations. The town of Osh in Kyrgyzstan is another bright example. The investment into HIV and drug use responses have really proven to be a sustainable investment in favor of broader public health challenges the cities faced. As time went by, 10 more cities joined Zero TB initiative and are now jointly working on improving TB programs. They have become active on hepatitis. And when we were hit by the COVID-19 epidemic, they were really the true basis to develop COVID response programs for key populations. Just to give an example, the 3 cities in Ukraine, Kiev, Odessa, and Dnipro, received rapid antigen tests and immediately started testing key population groups, even before vaccine arrived. Likewise, in Bosnia and Herzegovina, Sarajevo, Mostar, Bijeljina became really the first islands of response for key populations when no one else was there. I would like to acknowledge the very inspirational examples that we have seen in Europe for mayors' leadership in harm reduction. Pavel, what an honor to be in a session with you. Your example of making Prague a true hub for harm reduction interventions, of adding the necessary services for people who use drugs, of allocating resources from the city budget, from the national budget to these programs, became a true example to follow for other cities in Eastern Europe. Alec von Graffenried, the mayor of Bern, has received several dozens visitors from the cities of Eastern Europe to share the experience of organizing services for people who use drugs. safe injection room in Bern, the first one ever that was supported by the contact nets, is still hosting visitors and becoming an inspiration to response programs in our region. Therefore, to the Mayor's leadership movement.
Good morning, I'm Bertrand Audouin. I'm the Vice President of IAPAC for Strategic Partnership, and I coordinate the activities of IAPAC for Europe. We are very happy today to be part of this important meeting virtually. As you know, IAPAC is one of the 4 co-founders of the Fast Track Cities initiative back almost 7 years ago now. And the Fast Track Cities initiative focusing on a short list of objectives and targets. The first 3 are the 395 UNAIDS and WHO objectives. The 4th one is fighting stigma and discrimination. And the number 5 and 6 are coordinating programs on HIV with programs on HCV and with programs on tuberculosis. So to that end, the concept of harm reduction is really one of the concepts at the center of the initiative, because it is to the benefit of public health services, and it is the best way to connect HIV, HCV, and TB programs for a key population, but also to make sure that we do reach the 395s on HIV with less stigma and less discrimination. It is also an important concept for us from the perspective of human rights and taking people in consideration as individuals, no matter which community they come from. You know that in the past 2 years, cities and local administrations have demonstrated their ability to implement new programs and be innovative in health even more than before. And so with these 2 components together, we believe that now is the right time to talk about harm reduction in Europe and talk about how local administrations can actually keep on implementing new innovative programs that will help reach specific objectives on HIV and HCV. So we wish you very fruitful conversations in the course of that meeting, and we hope and trust that this meeting will lead to even better consideration of harm reduction programs, concepts, and services all over Europe. And we hope that we will be in touch very soon again. Thank you very much.
Tatiana Deschi has already mentioned the name of Mayor of Bern, and I'm pleased to share with you his greetings. So please, if we can have a greetings from the Mayor of Bern.
Ladies and gentlemen, dear colleagues, my name is Alec von Graffenried. I'm the mayor of the city of Bern, Switzerland, beautiful capital of Switzerland. I'm unhappy not to be with you at this moment, but I am very open to share our experiences in drug policy in the last 30 years. I think we had great problems, big problems in solving our drug problems. We had great problems with drug abuse, and we had, as I think, quite a sophisticated and quite successful policy in solving these problems, and I'd like to share our positive experiences with you. We can solve a major problem with harm reduction in many cities, as we did in the city of Bern in the last 30 years, because in 1990 we had great problems. We had many victims. We had a disaster situation in the streets of the city of Bern, Switzerland, as in the city of Zurich, Switzerland, for instance, where the problem was known like worldwide in the early 90s, the late 80s and the early 90s. how did we solve the problem? The most important is political will, and it's in some way a paradox situation. It's a paradox policy because everybody has to step over. For instance, police is here to repress all problems with drugs and drug traffic and so on. Police have to accept that they, in this case, have to, in some way, have to look away and have to act in a different way. Therapists, for therapists is pretty much the same. Therapists are here to prevent drug abuse, but they have to accept that in this case, they have to accept this drug abuse because it's different, it's a different setting. So everybody, therapists, social workers, police, everybody has to work together. So in my eyes, it's the best to form a municipal committee where all stakeholders, all parties are represented. And within this committee, you have to formulate a policy. Also include NGOs that are active in preventing drug abuse. Try to include everybody in this committee, in this working group, and you will succeed. Here in Bern, today we have a great, magnificent collaboration between police, therapists, social workers, and they all work in the same direction. They all work together in the same direction, and we had a big success. What happened now is that we had a great amount of heroin abuse. We had a great amount of heroin addicts in the 90s, and today we still have them. We still have basically the same population, but they get older and older, and we have less young people getting into heroin abuse, and that was the big success here in Bern. So try to introduce social medical offers as safe consumption rooms, substitution programs. We have substitution programs for methadone, heroin, drug checking, work integration. And as soon as you have set everything together, you will succeed and you will have less heroin addicts. And come to Bern. We are very open to show you how it worked here, and it works. It's a great success in politics because we have really succeeded. I hope that many other cities can handle their problems in the same way. I wish you good luck, and hopefully we can meet each other, and you are all invited to come to Bern if you have any further questions in this area. I wish you a very nice day. Thanks for listening, and goodbye.
Now we move from Bern to Vienna. Prague and Vienna are sister cities, and I already noticed in my presentation, Vienna Declaration, we shared examples of good practice with Vienna a lot during past several decades. So hopefully we now have online Hans Haltmayer, the Commissioner for Addiction and Drug Issues of the city of Vienna. Can we try to connect?
Can you hear me?
Yes.
Yes. Oh, that's nice. Hello, everybody. Thank you very much that I can join the meeting and the session. A warm greeting from Vienna from my side, and I'm glad to be with you, even if only online. You know, the COVID infection rate is still very high in Austria, not in Vienna, but in other areas, and so I have to stay safe here. I'd like to give you some aspects of the drug policy in Vienna and the attitude of the city of Vienna. I can only highlight some aspects because there is not enough time. For the city of Vienna, it's very important to allow drug users easy access to all health and social services in our beautiful city. And the first goal is to enable access to the common services, to primary health care, to social services like shelter and care homes. And it's not the intention to build extra services for drug users, and to separate them in that way. We want integration and not separation. So you have to address all the services for everybody in Vienna, health and social services, and to open it for drug users or drug addicts. There you have to do a lot of conversation, a lot of meetings, a lot of speaking to and cooperation. This works very well in the most cases. And for all the others, we try to create tailor-made settings to bring the services to where the people are. Let me give you some examples of the last 2 years. One example is we offer syringe exchange in pharmacies. We have the possibility for syringe exchange in low-threshold centers in Vienna, but we started a pilot project with 3 pharmacies to roll out, to offer syringes, needles and paraphernalia even in pharmacies. The rollout was delayed because of COVID, but I think this is a strong sign for destigmatization and normality. So syringe exchange is integrated in the normal health service of a pharmacy, and you don't have to go in a drug center or in a low-threshold drug facility. You just go to the pharmacy like everybody, and you can change your syringes there. Just a normal thing. Another example is drug checking. You know, we have drug checking. Check It is the name. We offer drug checking in Vienna, and additional to the normal services of Check It, to be at offer drug checking at events and at our home base, we offer drug checking in pharmacies. So the user or everybody who wants to use this service can deliver the sample anonymously in the pharmacy. He gets there a code, and with this code he can get information about the purity, about the potency, and about the contamination of the sample tested. Though it's a very easy access and it's a very important information to make it possible that there are no violence through drug use. And the last example is the project Let's End HCV in Vienna. It's part of the city government program. And we like to do ours to end hepatitis C, like the WHO program in 2030. And for that, we make low threshold access to HCV treatment possible for active drug users in OAT. We offer testing and treatment in a low threshold facility, and the patients take their HCV medication together with their OAT medication in their pharmacy. Just a normal thing. And since today, about 600 pivots started treatment and 479 finished treatment and 12-week follow-up treatment and follow-up period. And the cure rate was 99%. It's a great success, and even so that 76% had an ongoing intravenous drug use. So these are three examples for easy access to treatment, easy access to testing, easy access to health offers for drug users. And even in the public space, we try to bring the people together. The key to success is conversation and sharpenly the mission of the players. Through this path of regular exchange, you come to a good collaboration and you come to access. Mostly we are not in conflict to the national drug policy, but it depends on the current government. Until the Ibiza affair, you know, it was a problematic period because the right-wing party FPÖ was in the government. But currently there is a very good and constructive relationship. So at this point I will make a stop. Thank you that I can share our approach and experience with you. And I wish you a very good time and a lot of success in your own area and in your own area of influence. Thank you very much.
Hans, I hope you will stay with us until the end of the session to be part of the discussion. However, now we are privileged to move to three wonderful ladies representing three wonderful European cities. So please, I would like to invite Iryna Kutsenko, who is a member of the Ukrainian parliament and representing the wonderful city of Odessa. And since the time is running so fast, and I would love to have at least 15 minutes at the end for discussion, because this is my expectation that you have a lot of questions and there is a lot of information provided. So please be as fast as possible. Thank you.
Hello everyone. My name is Iryna Kutsenko. I'm Odessa City Council. And sorry, but I will speak in Russian, so wear your headphone. If your neighbor don't have a headphone, please take away and come back. То, что я буду рассказывать, должно вдохновить каждого.
with my contribution because it is extremely important for every member of community. I will talk about the life of our key target audiences. I will talk about the role of municipal administration, and I will talk about charities. I will also talk about political will. We hear a lot about political will, that we need political will, but I will start by saying that humanity has lost to drugs. And until we realize that we need to stop fighting drugs, we need to learn society to live in this reality, to teach society to live in this reality. This is our mayor, Mr. Trukhanov. And I would like to say thank you to organizers of this conference to have this opportunity to share Odessa's experience. A word of thanks to our mayor, who is the first Ukrainian mayor who openly said that people who use drugs need treatment. People who use drugs are the same people as other people in our town. They are our voters. They deserve respect. And I would like to also say thank you to the Public Health Alliance. We had Tatiana, we had Levgen here, because Odessa has been able to achieve what it has thanks to the efforts of this alliance. I would also like to say thank you to every person in the community, because you have turned my mentality around. I was an MP who closed a substitution therapy site in my precinct. 12 years ago, I banned a Pride in Odessa. But after I heard the voices of my constituents who came to me and spoke to me in my office, we also received a letter from the Alliance for Public Health, and I was referred to Harm Reduction Academy, and I changed my thinking. I began to act differently. We opened many substitution therapy centers in Odessa. And I would like to emphasize the role of every individual here. You are more than people who advocate for your regions and your communities. You are people who can change the situation in your cities, in your countries. Talk about it. Talk to the media. Go to social networks. If you don't know how to find your elected representatives, remember, you are constituents. Come to me and I'll explain to you in the lobby how to find your MP. If they don't understand what substitute therapy is about, if they don't understand why they should invest in users, because they're going to die anyway, refer them to the Harm Reduction Academy. It is a great project which will educate them. What did we do in Odessa? After one person, and that was me, understood the problem, I was able to explain it to our mayor. We held 47 meetings with MPs, with different commissions. We had public hearings. And as the result, we introduced our first fast-track city program, split into 4 pillars: HIV, TB, substitute therapy, and harm reduction, including the education element, because we realized that it is not enough to launch supervised consumption rooms or substitute therapy centers. That's not enough. We need to integrate. We are using the model from Iceland. We work with schools. Every school child participates in extracurricular activities in our town. Our kids can join singing clubs, music clubs, different hobby groups free of charge. We also talk to schools. We work with children as young as 9 years old because we see that even such young kids begin to take drugs. So we deployed prevention programs. We also evaluated situation and found out that we have 22,000 injection users in Odessa. But today, I'll show you those graphs maybe later. This is the needle replacement program. These are numbers for 2020. Now we have 689 people involved in substitution therapy, and we are ready to sign a memorandum on opening a consumption room in Odessa, although our national law prohibits that. Because we were able to reach consensus with the head of the police force in our region. We explained the situation, and he also understood that they cannot stop consumption. Our room is a service room, that's what we call it. Every user will have a membership card, and if they get stopped and searched and they present this card, they will not be detained. In our service room, they can get counseling. They can take a shower there. If the person says that they're unemployed, they will receive support in looking for a job. We will also offer them a switch to substitution therapy. We will refer them to other social services, such as testing. I know I only have 1 minute left, and that's not a lot of time, so let me just say the main thing. We also work in TB, also great results with TB, but the main thing is this. Do not be those people who think that nothing can be done. You can achieve change. If you give up because you don't know how to talk to your politicians, go to their offices, knock on their doors every week. Use Facebook, send letters to your representatives. Look for laws that will make your MPs work. Do not remain silent, because what we do together saves lives and helps society as a whole. Thank you all for helping me. Thank you, Matt, for educating me in the Harm Reduction Academy. I will always be ready to help. I will always be ready to share. Thank you.
Hello, ladies and gentlemen. I do not have 12 years of experience in politics. This is my second year only when I'm involved in healthcare policy, and other issues. So thank you very much for the invitation. I will tell you about what we do in our city. We want to invest into safe and healthy future of our citizens. We take a human approach. That means that we need to provide on-time services related to prevention, treatment, irrespective of HIV status, religion, health status, or participation in one or the other key groups. For us, these aspects are very important, irrespective of who is the person. Also, we need to take into account that all the measures that we take also impact the general health. We all know that prevention is cheaper than a comprehensive set of measures directed at dealing with undesirable consequences. Statistics show us that a risk group, and when we look at the key groups and the number of provided services is up to the capital city of our country. That's why our municipality focuses on important initiatives such as the Paris Declaration or the fast-track cities. In order to reach these objectives, as I'm the deputy mayor, we've been focusing on defining indicators and funding implementation of the municipal plan, focusing on the fight against HIV, TB, and also HCVs. We also cooperate with Public Health Alliance. We also involve other structures, organizations such as the Narcology Service, Police, Probation Service, and Cabinet for issuing ARV. We also would like to progress in the area of testing, HIV testing, and providing services to key groups under the pandemic situation. We also have a mobile app that helps with informing police and helping our clients. What are the short-term priorities? First of all, developing digital solution in the area of public health, focusing on raising awareness, supporting treatment, then integrated assistance for key groups, and then introduction of vending machines for harm reduction tools. And we also need to take many other steps together for every single citizen of our capital. Thank you very much for your attention.
Finally, I will introduce a person as well. You know, where I come from, HIV is an urban disease. Therefore, cities and local administration have a crucial role to play. We rely on political leadership of municipality authorities facing the epidemics. The person I will introduce to you, it's Fotini Leobilla. It's the person to go for the mayor of Athens regarding drug policies and regarding harm reduction and everything drug-related. Fotini took part and played a very crucial role in a project, in a snowball project called Aristotle, who actually confronted and intercepted the HIV outbreak and injecting drug users between 2011 and 2013. I'm one of the recorded incidents of that period. I have also to mention that Aristotle was strongly supported by the OST public structure, OCANA, Organism Against Narcotic, and civil society organizations as Positive Voice, my organization. Fotini is the president of the Prevention Centers of the Municipality of Athens, is vice chair of KETHEA. KETHEA is the largest substance-free rehabilitation center, and as I told you, her crucial role is that is the Councilor of Athens, the Councilor of the Mayor of Athens. So let's welcome Fotini Leobilla.
Thank you, Mare, for my introduction and my presentation. Thank you. Thank you all, and good morning to everybody. I want to thank the co-organization for their kind invitation to be here today. It's a great opportunity to us to learn from the examples of other cities and to share our experience in the field and how we address the problems that, as I said morning, it's similar, I mean, for the most of the capital cities about the drug users or the rest of the vulnerable groups. So I am here in front of you to talk about what Athens did or does about people who inject drugs, about homeless people, and how we confront the problem with COVID and all the others. So it was last year, March 2020, when the government says to us, stay home, because it was locked down. You should stay home. And the mayor called me and tell me, okay, we tell to the people, go and stay home. What about the homeless now? And especially the drug user homeless, because since then, the municipality of Athens, they got 2 shelters, but it was for general population who were homeless. They didn't accept drug user. So, really, in less than 1 month, we managed to have the first shelter for temporary hospitality for people that they are homeless and they use drugs. They are active drug users. And we have them, and there's capacity for 70 people. Last July, I got 92 people, July of 2020. But to be able to, to confront all the problems that we have, because it's not an easy structure, it's not an easy facility, because you have to face a lot of problems. They do drugs, you have to take care of their health with huge health problem, HIV, hepatitis, other problems with open wounds and all this, and we try to give them assistance. So the first shelter is a fact, and I'm very proud of it. And now we go to the next step for the shelter, because we are going to move to a new, another building, which the conditions are better. and we ensure the funding for the next 3 years for all these services. It's again in the downtown of Athens. Now we have plans for other 2 things. I mean, from the first, Mr. Bakoyan is the mayor elected. We have, let's say, 3 goals. The one was the shelter and dormitories. The second was the drug consumption rooms. Because until then, Athens didn't have a consumption room. It was the Greek paradox that in 2012 we got a consumption room but not legislation, and then in 2020 we got a legislation but not a consumption room. You understand what I mean? So now we cooperate with the president of Okana, and Okana is ready to run consumption room steady, I mean like a building, and we as a municipality with his assistance, we're gonna run 5 mobile units as a consumption rooms, and we hope the next maybe no more than 6 months they're gonna run all over Athens 24 hours per day for 7 days per week. So this is the second. The third, the third was about naloxone. We try, as a part of the Partnership for Healthy Cities, we try to run a program for prevention of overdose. Unfortunately, we don't have the right legislation to allow us to run this kind of program. Now, 2 years, Mayor, myself, a lot of people, the President of Okana, Kethia, we are trying to push, to press to the ministry to take a new decision that allowed us to run this kind of program, so all the drug users and the members of their families to have easy access to naloxone to save their lives. So I hope in the next conference for harm reduction to be able to say that, yes, we got mobile units and they function all day. Yes, we got naloxone program. Yes, we have dormitories and hostel for homeless people. This is my wish, and I hope to share it with you. Thank you for your attention.
Thank you very much, Madame Leobilla. We are at the end of line of 11 speakers, just crazy. But we are also running out of the time. So we have like 5, maybe 7 minutes to discuss all these aspects of the problem, cities and drug policies, community empowerment. How to get everybody concerned around the same table. How to mobilize the community. How to educate, and how the public awareness should look like, how to reduce the violence, how to make coherent or look at the incoherence between the local drug policies and legislation and the national drug legislation, etc., etc. So many questions and so little time. Please, floor is yours. Just ask questions to all of our speakers.
Thank you to everyone. I'll be as brief as possible. Austin, you mentioned the relationship of the 3 philosophies, harm reduction, social determinants of health, and early trauma, and how you managed to patch them together and also support them together. Have you written that up anywhere? Okay, well, that's something we'll work on together, because I think that's really important.
No, I absolutely agree with you. I think each of those philosophies gives you different perspectives on the problems, and I think actually ultimately equips you with a better approach to address the issues that are faced by all our clients. Yeah.
I want to thank you, all the speakers. I don't know if I missed it, but one important element in the continuum of care is mental health services, comprehensive harm reduction psychotherapy, working with drug users to help deal with the trauma and the underlying issues that actually perpetuate some risk behaviors and other issues around gender, sexual identity, and other issues like this that really need to be addressed, not just HIV and TB, but the issues that compel the risk behaviors and perpetuate them thereafter, such as effective behavioral interventions and things like this. So I was wondering, have any of you considered these issues, and are these services available?
Who wishes to comment that? I would 100% agree with everything you said.
Я возьму ответить на часть этого вопроса. Мы разделили ответственность между разными категориями. Если политики несут ответственность для того, чтобы принимать законодательные акты внутри города, а также финансирование, общественные организации должны заниматься вопросом поиска людей на улице и вовлечения их в программы.
Find people in the streets and bring them to our programs. Social workers are the ones who take care of social work, and medical professionals must take care of the treatment. So it is a multidisciplinary approach, and that's the approach that we preach. As a politician, it is not my role to try and find out what is going on in the person's life. It is their decision. They decided to take drugs, but that's not my job to investigate that. I'm the one who is there to find funding for a service that will help this person. So we should each do our job. We cannot, all of us, deal with mental health issues of each individual. That would not be effective.
I comment on that. I think that once we accept that most of our clients have gone through fundamental traumas in their early childhood or in their lives, it generates a compassion in our heart, opening the space for tolerance and acceptance, and knowledge that almost all of our patients or clients just need some comprehensive mental health care, which is absolutely unavailable in the scope we would need. So it's, for me, is one of the biggest challenges for us for the future, even though HR paradigm and philosophy is fundamentally based on the challenge how to survive. Well, the question is not only how to survive, but how to survive with at least a little bit of happy life. So, I mean, yeah, thank you for this question. Probably we have space for 2 more questions, and that's it. One, okay. Okay.
First, yes. My question goes to the MP from Odessa. Spasibo Bolshoi for your very good presentation. In Norway now we have a particularly complicated political situation in terms of drug policy reform that crashed, but we still want to do some process. And some important stakeholders, they still cling on to, I would say, some backwards attitudes when it comes to drug use. You need to penalize them to prevent further drug use and so on. So as kind of a working from the users organization to influence politicians, I have a question for you. how to change hearts and minds. And so you said that you changed quite some fundamental attitudes, and the question was, what was the essential message that did this to you? So.
Знаете, какой подход, что должны сделать вы? Это достучаться, во-первых, зайти в кабинет к политику.
Go to their office, and the first question you ask there when you get there is, are you sure that your own daughter or your own son is not a member of our community? Somebody will tell you, this does not concern my family. Ask your second question. How can you be sure that your niece or nephew or your neighbor will not be concerned? And the second thing you need to do is get the real numbers. Don't make a nice PowerPoint presentation. Give them the rough, ugly numbers. And if the numbers are changing, if the trend is negative, tell them about it. Because inconvenient numbers are what changes their mindset. If you see a negative development, if the numbers are growing, talk about lethality. You know, Marx said once that we can build great roads, we can build beautiful buildings, we can build great hospitals, schools. But if people continue to die, what are we building those buildings and roads for? You will only have 5 minutes of your MP's attention. Use those 5 minutes to show the maximum of the negative situation today and give them a solution, and then they will start asking you questions. They will ask you how to involve you. Use exchange programs. Take your MPs to Bern, to Geneva. Show them how things can be done differently, and that will help them change.
Final question. I can take you. Okay, yes.
No, and I'm sorry for swearing, you fucking don't. Because tolerance is an oppressive concept that has been devised by the privileged and the moral to keep the ones that are not really accepted in a position to be allowed to be free to choose and to behave as they want. The thing that we actually need and want is respect. No more and no freaking less.
We are on the same page.
Yes.
After this so substantial and meaningful comment, we have to close. But allow me to close with my mantra. We talked here, we discussed here about projects and policies. Every project and every policy is condemned to fail if it does not include the insight of the directly affected community, the people who use drugs. We are not passive receptors of services, but we are actually the most crucial actors and expert to all that, and we demand to take part to the design and the implementation of programs and services that are addressed to us. So power to the peers, power to harm reduction, and power to the people who use drugs.
Many thanks to all speakers involved. Eberhard, sorry, we with Marius totally failed in keeping the time. So it's our failure, sorry for that, and thank you for your patience.
At this very last session, I think that that is a very important moment. It's already mentioned on several occasions, but this is a very special event for many reasons. Because all of us are here, and also because I would like to give the floor to one of the key people in harm reduction in Europe, Eberhard. He already mentioned Eberhard is going to retire.
Yesterday,
on the first day I started an applause, and today I have a small tear in my eye. I would like to ask a couple of questions to put for a couple of minutes the spotlight on Eberhard. Eberhard always gave the floor to everyone, to all of you, but on this occasion I would like to put him in the spotlight. Eberhard, if you look back on 20, 30 years of your work, what is your, let's say, your professional highlight?
My professional highlight, I don't think I can answer that, because there were so many, and I would say the entire process on what we developed through more than 20 years, that was all the time a professional highlight, and it is until today that I, knip in your arm, and is that really true, and can I make this job? So it was such an honor, such a pleasure, and such a highlight through almost 20 or even more years that I cannot even mention just one thing. But I also want to emphasize that, of course, that was not only my thing. It was the team, it was Katrin, where I worked for so many years together in a very balanced and very fair and fruitful and synergic way. So only that team and this working together made all this true. So at the same time, I think to go out now with this conference and with all of you in the room is really a quite good thing to do.
Then a final question. Eberhard, what are you going to do? What are you going to do tomorrow? What are you looking forward to start doing over the next weeks, months, years?
Tomorrow I stay in Prague and enjoy with my wife this beautiful city. And next year I start to help Correlation to draft a new application for the new EU program. So it's some kind of going on. And next year I think I will try to read a good book, maybe a thick book like Tolstoy or something like that. And also, we have a grandson with 2 years, which is a great pleasure. And I have a very old house which continuously needs reconstruction. So I will be very busy. I have no doubt about that.
Thank you very much.
Stande ovatie.
Bravo!
Yeah. I think there is nothing else to add than to say thanks to Eberhard, but I also want to thank all of you for coming to Prague, for being here, for being so enthusiastic, for being here with us. So my thanks go to the participants, to all the speakers, to all the chairs, to all funders and supporters, to the Rainbow Group, to Sananim for organizing this here at local level. ERA, will come something more for Sananim. So ERA and Euro Input, all the other partners like UNODC, but also, in very particular, the drug using community and the sex worker community who was here with us. And now we come to the more particular things.
and I would like to ask Jiří Richter of Gigi from Sananim to come here, because I think without him we wouldn't have been able to organize this conference. And together with him, I'm not sure if Dasha is here from Sananim. If she's here, I would like to ask her to come here and also to stand up, all the volunteers from Sananim who were here helping us in all the time, and give a warm welcome. And thanks for being here.
Thank you very much. I love flowers. However, I think in my hands it's not so nice as in women's hands. And I was just thinking whom to pass it. I feel it's a torch, it's a future. And I would like to pass it to our young doctors from the drop-in center, because they are absolutely amazing, and I think it's very relevant if I give it to them. Thank you very much.
And probably I would like to ask all volunteers from Sananim to come later here and pick up a small present, only a small present from us. There is also a warm thank goes to the translators who were, I wouldn't say were quiet, they were very active and they helped us in translating. Thanks. And also for you, we will have some small presents for you here. Special thanks go to Metzineres and the whole team, Aura, Filipa, and Tre. Stand up, please. And come here, there are some small presents, please. Also, the team of energy control and Miraya. I don't know if some of you have been there, but they had the whole testing machine here and they did a great training and overview show, and I think that's great. And one more time about Metzineres, I think some of you might have realized that there was a kind of safe room for people who could get all kind of harm reduction support and advice, and I think this was really great because they were really essential service here in Prague. So thanks again to both of you, Miraya and also would like to ask all the Regenboog volunteers to stand up and get a warm thank you and also get some presents later on. I don't know, where are they? Yay! And then I think we will see after this last thanks a short summary, a video of the whole conference. You will see yourself and others and your colleagues. And as always, this video has been prepared by our colleagues from the Drug Reporter team, by Peter Zarosi and Istvan. Please stand up and thanks. And last but not least, I would like to thank the whole correlation team, Eberhard, Steve, Lea, Joanna, Pina, Roberto, and myself. So thanks a lot. If it's good, you find on your own chair or on the chair next to you an evaluation form. Please fill it in. There will be people outside standing and not letting you out of the room before you have filled it in. And you can, if there is no one standing, you can just put it there on the table. It might not seem important to you, but for us it is, because it is also something we can show to our funders. So please fill it in. And in the meantime, I would like to ask the people from the technique to show the video. So thanks a lot for being here. Till next time.
I don't know, what should I say? Here we are. Yeah, I think it's really amazing. We started to prepare this conference in 2019 and postponed it 4 times. And this time, November 21, it has to happen. And again, we are here.
We have more than 400 participants, and we are actually all overwhelmed by the interest of people here coming to the conference. We see that people really want to come together, and they are somehow fed up with meeting online, so it's great to be here.
We have celebrated 30 years of existence in Synonym last year. Because of COVID, we do not have a chance to celebrate much. So this is one of the most nice presents we get. I mean, to get the harm reduction conference in Prague. Synonym is one of the largest, or there are 2 large organizations in Czech Republic, and both are doing everything from the complex care, let's say, from the outreach to the aftercare.
It's our mobile unit from Synonym from Prague. We work at the open drug market. We are doing needle exchange, hepatitis testing, HIV testing, COVID testing, and now COVID vaccination, and a lot of health care.
At the moment, we are fighting for existence again after the 30 years, more or less. Even we probably have the largest network of harm reduction services in Europe. It doesn't mean that it will be there tomorrow.
I'm very happy to be here. I'm learning a lot, and I think also this conference is a very interesting space of diversity, which I think is really, really important.
There's one group that I was told that has a very strong representation in this conference, which is the sex workers community. Thank you also for coming out and being part of this conference.
In many harm reduction services, the majority of the clients are men. Transgender people and women, they don't have enough opportunities to share with us because the space is not safe. So also this is the reason why last year we started to provide services specifically dedicated to women and to trans women.
Since the people who are engaging in chemsex are mostly from already marginalized communities like the MSM or transgender people or sex workers, they are being stigmatized on 2 different levels, as part of one community and as drug users. So we kind of have to have like a multiple angle approach in order to actually understand what is going on and approach them and offer the services they need in the way that they need to have them.
We are now kind of speaking more and trying to inform people in the region more about new psychoactive substances, what they are, because people are getting quite a lot of not real, not correct information.
While in the United States people are nostalgic for good old heroin because it's being replaced by fentanyl, in Estonia this is already old news. Fentanyl is being replaced by the new nitazines, or the so-called benzimidazole group opioids, which of course are untested on humans and can be very dangerous as usual. But I think it's still not going to break any records because naloxone is made more and more available. If at all possible, use drug checking services.
We have a new system to quantify drugs. And this machine that we have here is based off FTR technology. 15 seconds it takes to analyze the drug. We don't need reagents, so we can do as much samples as we want without any reagents. It's non-destructive. People can have it in a second and then can take back that sample, which is amazing. We have a drug analyze system which can analyze more than 200 drugs, since cannabis, cocaine, MDMA, methamphetamine, amphetamine, ketamine, heroin, cocaine, and way more. You just put the sample and then you just press, wait 15 seconds, and then you will have that, boomba. So it shows that it's MDMA 85% and the other one is 83%. The results of the machine quantify, which is new. And for sure we work as well with cannabis, which is also really new with this technology. We can quantify THC, but also extracts and oils. We go to drug consumption rooms and festivals, and then we are able to analyze a lot of drugs.
We did a research on community perceptions of mobile drug consumption rooms in Lisbon. There's a really high level of acceptability. 100% of participants in both data rounds were accepting of the service in the neighborhood, and they really understood what the service is, that it's aimed for people who use drugs, that it's a health and harm reduction service. They said that they think it's a good service to support people who use drugs, that it's good for their health and well-being.
You know, it's more and more important that, you know, you can't do harm reduction without having young people telling you how we need it done, because if you don't understand youth drug use, you won't be able to implement it. So that's why we need to be here, and we're so glad to be, you know.
We had a lot of feedback that it's actually, for a lot of people, it's the first time that they heard a youth panel made up of exclusively young people, focusing on young people and young people's participation. So it was very, very rewarding.
Young people want peers. They want to know about these things from people who are closer to their age and not some older police officers telling them not to do drugs.
We, drug users, we begin with calls for harm reduction 30, 35 years ago. And all these harm reduction organizations have basically roots into the drug user movement from 80s. So maybe it's time to recognize this and give back the powers to the drug users themselves, ourselves.